Hello, I'm Dr. Mary Ellen Shannon. I'm a board-certified OBGYN. I've practiced in Phoenix, Arizona for almost 20 years, and I loved practicing medicine. I loved delivering babies. It was a thrill, but unfortunately my passion kind of turned into an obsession because I didn't want to miss any deliveries. I got very attached to all my patients, and I wanted to be there for the finale. And that meant staying up many nights and having very long days in the office. I started becoming very fatigued, and so I said, well, I'll take some prenatal vitamins. Maybe that will help me. And I had those in the office, so I randomly started taking prenatal vitamins. And that didn't quite pick up my energy. I was trying to reduce the number of deliveries and trying to take care of myself. I did get routine blood tests and everything came back normal, but I just wasn't feeling right. And then I felt like I was getting a cold. So I started taking large doses of vitamin C because I knew that was a great antioxidant. And I still didn't feel better. I just kept on getting worse and worse. So one day when I was doing a delivery at the hospital, I decided to go down to the emergency room and to get a chest x-ray. And the ER doctor said, he recommended that I be admitted immediately because my heart was 5 times the size of normal. And I ended up going to ICU. I spent 3 weeks in ICU. And they diagnosed me with a genetic disorder called hemochromatosis. Hemochromatosis is an iron storage disease, which it causes you to absorb too much iron. And so all my organs in my body were flooded with iron. And I was really embarrassed because I was actually poisoning myself by taking prenatal vitamins, which is loaded with iron. And then the vitamin C aids the absorption of the iron to my system. Hemochromatosis, the gene itself, occurs in 1 out of 4 people from Irish descent. So I have a double gene, abnormal gene for that disease. And if it's detected early, it can be easily managed by just doing phlebotomies or blood donations. But unfortunately, mine was a delayed diagnosis, so the iron went into all my organs. They even told me that I needed a dual transplant, a liver and a heart transplant. Or else they said I wasn't going to live for 2 years, no longer than 2 years. I thought, oh gosh, I don't feel that bad. I refused the dual transplant, went home, and my family and I researched for other alternatives. And we learned about hemochromatosis. Immediately, I did a lifestyle change. I also did dietary changes, took out all the iron in my diet, and then I started to research more of what I can do nutritionally for my failing heart. I came across a book by Dr. Mark Houston, which exactly talked about how you can do dietary changes, supplements to help a failing heart. To my amazement, within a year, my heart returned to normal. And my ejection fraction went from 11% to 65%. And it still remains normal today. I was simply amazed by what you can do by just changing your lifestyle and your diet to reverse a major disease and avoid a transplant, which could have had long-term effects for the rest of my life. So that's how I got to the A4M program. I wanted to do a fellowship, learn more about how nutrition affects the body and what I can do to continue down the pathway of healing. I have learned a tremendous amount where I want to start helping other people and sharing this knowledge. I started a medical consultation online called caringmedicalsolutions.com. It's a website that you can go to where I can help you develop an individualized plan tailored towards your identified risk factors, because we want to see if you're going down the wrong pathway and catch it before you actually get a disease and correct that by adjusting your diet and then do a follow-up test to see where you are so that you can prevent getting a major illness. If you'd like to learn more of what I can do and how I can help you to maintain optimal health, please come visit my website at caringmedicalsolutions.com.